Howdy everyone, Matt and Matteo here, coming at you with another orthopedic special test, and this one is for the knee. It is the Posterior Sag Sign. This test came from a paper back in 1903 by Dr. A.W. Mayo Robson. And he had a mine worker who was involved in an injury, and he noted something about their knee. And he says, when the muscles were braced up, the bones in good position, but as soon as the muscles relaxed, the tibia fell backwards until stopped by the ligamentum patellae. On manipulation, the head of the tibia could be brought forward in front of the femur. And he later went in and did surgery on the patient's knee and noted a torn ACL and PCL, which he said after repairing it, everything did become stable. So to perform this test, it's actually very, very simple. You have the person laying down. Matteo was gracious enough to do that for us. You flex the hip to about 45 degrees, the knee to 90 degrees, and then with the foot flat, you just observe the leg here. And if the person has a torn PCL, the tibia is going to shift backwards because in a normal position, the tibia is about a centimeter in front of the femoral condyles here. So without that PCL in its position, that tibia is just going to fall backwards like that. So it's a very, very simple test to perform. When we get in terms of the research on it, there's actually not a lot of research on this test. But there is one paper where researchers did look at people with ACL, PCL tears. They had varying degrees, a 1, 2, or a 3, and they performed a handful of ACL and PCL tests to confirm did the person actually have one of the tears. And they did find overall that the lower grade tears were a little bit harder to detect. So the sensitivity wasn't as good with those tests, but it improved with the 2s and 3s. So with this test, specifically the posterior sag sign, it did have a sensitivity of 79 and a specificity of 100. So it is a pretty good test to do overall. So that is the posterior sag sign for a PCL tear. Let me know, do you use this test? Have you ever had a positive with this test? Let me know down in the comments below. And like always, as Matteo says, take care of yourself, take care of your patients. We'll see you then.